the infection rates in Kenya are now high.
The Ministry of Health now responds to the issues raised several times by health workers.
It is individual responsibility.
Currently, we're running at more than 90% of our capacity. So we are already hitting our surge capacity. Are we similar to public? Definitely. And I think you'll see that this is represented in most of the private facilities in Nairobi at the moment.
Dr. Shamsa Ahmed is the head of Infectious Diseases Unit at MP Shah Hospital in Nairobi, and she explains the recent cause of the coronavirus infection.
From June, we kind of had a slow rise, and in July, we are hitting our peak. And I'm sure in August, we're just going to continue probably to the end of August and maybe early September.
There has also been a change in the group of most affected individuals.
In this wave, my patients are a lot younger and they don't have any underlying illness. So what we're seeing right now is a pandemic of the young unvaccinated population. Previously, I wasn't seeing anyone under the age of 40. Now I'm seeing 27 and 28-year-olds.
Students at various learning institutions in the country have also not been spared, as has been witnessed in recent weeks.
We've had a lot of that age group of high school, especially in boarding schools.
The danger in schools is more to do with the teachers than to do with the students. So hopefully the teachers will accept and agree that they all should be vaccinated.
According to the World Health Organization, there are coronavirus disease patients who are left with long-term effects of the virus even after recovery.
Some of the most common symptoms of post-COVID-19 condition, or as you said, long COVID, include shortness of breath, cognitive dysfunction, which people call brain fog, as well as fatigue. Other symptoms that patients or people may experience include things such as chest pain, such as trouble speaking. Some have described anxiety or depression.
Urging Kenyans to be vaccinated against coronavirus, Dr. Ahmed explains part of the cost of treatment in the ICU unit at a private hospital.
The antivirals and the interleukins range anywhere from 150,000 for a dose to 200,000 for a single dose. Our ICU is continuously full, meaning as soon as the patient is stable or able to move out, we have someone ready who is waiting for that bed. We are reaching a point of having to do referrals.
Her plea to Kenyans now is this:
is to get something called a pulse oximeter. It's that little gadget that you put on your finger and you can see your oxygen levels. If your oxygen levels are getting to 94% or less, just go into your nearest hospital, get evaluated by a doctor who has been managing these things, which is most casualties at the moment, and they can advise you on the tests that need to be done and whether you're a patient for admission or not.
Even with fatigue that comes with multiple prevention protocols, keeping COVID-19 at bay comes down to personal responsibility as the coronavirus disease gradually becomes a norm. Ben Kerera, K24, Nairobi.